Hi everyone, whoever is joining in. Gonna give it a couple of minutes before we get started. To those just joining in, hello.
Hello.
Hi, how's it
How are
going?
you?
I am good, thanks for asking.
Hello, everyone.
Want to give it a few minutes before we get started?
Yes, ma'am.
Okay. How's your day going?
It's going pretty good. What about yours?
It's been good. Busy, but good.
Yeah. Hello, everyone joining in. So about 6:03.
Yeah, that sounds good.
You're still at the office?
It'd be a lot easier just to do it from here versus taking the chance of me not getting home in time.
Okay.
Yeah.
Totally get it.
So we can go ahead and get started. We're going to start with introductions. My name is Nancy. I am a community health educator here at Whitman-Walker Health.
I am Chi. So I am the youth prevention supervisor at our Eastern Market location for our youth services department. The pronouns that I like to use is she, her, hers.
So for those that are just now joining in and did not hear me introduce myself, I can introduce myself again. My name is Nancy. I am a community health educator here, and my pronouns are also she, her, hers. So today, what we're going to be talking about is Breast Cancer Awareness Month, since it is October. What we're going to be doing is a little quiz that you can play along with if you're watching at home.
So, as Nancy said, that this is Breast Cancer Awareness Month. So, breast cancer is the most common cancer in women worldwide. Just to give you some statistics, 1 in 8 women will develop breast cancer in their lifetime. So, I'll say it again: 1 in 8 women will develop breast cancer in their lifetime. So, nearly 30% of all new cancer diagnosis among women will be breast cancer, and every 2 minutes, a woman is diagnosed with breast cancer in the United States.
So, we're saying all of that just to remind you how significant breast cancer is in the lives of millions of people. So, by learning more about breast cancer, we can improve prevention, identification, and treatment.
Okay, so we can get started with the breast cancer trivia informational session. So, what does that mean? That means for everybody that's tuned in, we need you guys to participate. So I see a touch of too late in the comments already participating. Those really were alarming numbers. So we need for everybody to pay close attention, tune in, answer questions, hit the triangle at the bottom, and get people to tune in because breast cancer is a really serious topic and it affects a lot of women and African American women as well. So sit back and enjoy.
Yeah, it's more fun for everyone if you participate alongside with us. So we can get started with the first question. Question number one, what is a risk factor for developing breast cancer? Is it A, family history, B, being vegan, C, being young, or D, being a man? So you can comment your answer in the comments and we'll check them out.
So we're going to get an audience a few seconds to decide. And Nancy, you might want to go back over it so that
Sure.
they can hear you.
Definitely. If you need me to repeat them again, I'll go ahead and do that. So, once again, the question is, what is a risk factor for developing breast cancer? A, family history, B, being vegan, C, being young, or D, being a man. And I see some answers already. It looks like the consensus is for A.
So, which one is it? The answer is A, family history. So there are three major risk factors that make developing breast cancer more likely. So family history, two inherited genetic mutations can lead to breast cancer. You may have heard of them. So it's BRCA1 and BRCA2, where BRCA just stands for breast cancer. So being a woman, 99% of breast cancer diagnoses are in women who were born female and identify as women. Being older, most breast cancers are found in women over the age of 50.
So, what if I don't fall underneath those categories? Does that mean that I can't get breast cancer?
No, you definitely can get breast cancer based off of if you're young, a man, and a vegan. It's just those traits wouldn't put you at risk.
Got it. Got it. Thank you.
Okay, so moving on. So, question two. Signs and symptoms of breast cancer include A, pain or lumps in the breast or underarm, B, change in breast size and shape, C, nipple discharge other than milk, or D, all of the above.
So, let's just give everyone a couple of seconds once again to answer in the chat.
So for those of you that are joining in, Nancy and I are playing trivia, and so we're asking questions that relate to breast cancer, and we would hope that you guys know the answers, and if not, can try your hand. So again, I'm going to read the question again. Signs and symptoms of breast cancer include A, pain or lumps in the breast or underarm, B, change in breast size and shape, C, nipple discharge other than milk, or D, all of the above.
And it's okay if you don't know the answer, feel free to guess. We'll definitely be giving you the answer. So, if you don't know, at least you'll walk away learning something new.
Okay, so I see one person in the comment. Is there anybody else? I see two.
Anyone else before we reveal the answer? Okay, so I'll go ahead and give the answer. The answer is D, all of the above. Breast cancer can present itself with any of these symptoms that she had mentioned, which include pain in any area of the breast, new lumps in the breast or underarm, change in breast size, shape, or nipple discharge other than breast milk.
Okay, so if you experience any of those symptoms, does that mean that I have breast cancer?
Not necessarily, and that's definitely something to take away from this is that even though you are experiencing those symptoms, it doesn't always mean breast cancer. We don't want to scare anyone. It could be another medical problem, which is why if you are experiencing any of those symptoms, you should speak with a medical provider who will help you find a diagnosis. Don't go on WebMD or Google.
Okay, that sounds cool. So that brings us to our next question. So this is a true or false question. Is everybody in the comments ready? True or false? A mammogram is dangerous. Just some background. A mammogram is a medical tool used for screening breast cancer.
So this one I'm the most interested in hearing the answer for because I've definitely heard um, both sides of that question, whether it's true or false.
Y'all ready? Okay. So drum roll, please. Anybody in the comments has something to add?
You got a 50-50 chance, true or false.
Well, I hope I don't disappoint you because I'm going to give you kind of a wishy-washy answer. So when you get a mammogram, an x-ray is taking a picture of your breast to visualize any cancer. X-ray radiation is dangerous. So in that sense, yes, you don't want to have too many mammograms, but the mammogram is an important tool to diagnose breast cancer. So they're pretty necessary to minimize your risk and maximize your benefits. Medical providers might not recommend a mammogram for many of their patients before a certain age, like 40 or 45. But it's important that you talk to your medical provider about the risks and benefits of undergoing a mammogram as a breast cancer screening, because every person and every provider will have a oh, I'm sorry.
No worries. But what she was saying was every person and every provider is going to have a different recommendation. So having a good relationship with your doctor is super important because then they'll know what's best for you and your own health. But another thing to consider is that you can also do self breast inspection pretty easily by feeling for any new lumps or pains. So while you can't see inside the breast like with the mammogram, the self breast inspection will alert you of any unusual signs of potential breast cancer. So now for our last question. This is question number 4, another true or false. Men are more likely to die of breast cancer rather than women. So take a minute to think about it. I'll say it again. True or false? Men are more likely to die of breast cancer than women.
I don't hear about breast cancer as much in men, so I'm thinking the answer may be false.
Does anyone else want to chime in with their own answer? True or false? So I totally get why you would say false. But you are wrong. It is actually true. And the reason is that men carry a higher mortality rate for breast cancer than women. So I definitely would have thought false as well, because again, you don't hear about it that often. But how scientists explain this is because breast cancer awareness among men is lower. So men are less likely to assume that a lump, pain, or any other sign or symptom is breast cancer. So any delay in seeking and receiving treatment will hurt health outcomes.
Well, good thing we're doing this live today to spread awareness. Um, because if we weren't doing this live, I don't think myself or anyone else and that has joined would have had some clear understanding of the answers.
Right, right. I definitely learned quite a few things tonight. If anyone has any final questions, please put them in the chat so we can answer them. And so Also, feel free to tell us how you did on the trivia. Did you get any wrong, any right?
How many people got all of them right?
It's okay if no one did. I wouldn't have gotten them all right.
Yeah, I certainly learned a lot, and I'm definitely going to share this information with a lot of my friends,
Hmm.
especially my girlfriends. But
Right. I'll definitely be sharing this with my roommates tonight.
okay, as such as too late. Just got the last one wrong. Me too. Me too.
Also,
So
make
our
sure, sorry,
yeah. No, you're
make
okay,
sure,
Nancy.
make sure to share this with your male friends as well, because again, it doesn't just affect women or women-aligned folks.
Right.
So if you have any questions or concerns about breast cancer that maybe you don't feel comfortable sharing here on the chat, Women-Walker Health is here to support you with our cancer navigation services. So you can give us a call at 202-797-4409 or email arkita at women-walker.org. And if you look at the pinned comment, it has all the information that I just said. Additionally, oh, actually, Chi, if you want to chime in on this part.
Okay. So if you are a breast cancer survivor, you may be eligible to participate in a in a quality of life breast cancer study through Georgetown University, and it's also being offered at Howard University. So participants can receive a personal health profile and $135 Visa gift card. You can call 202-709-6590 or visit the link pinned in the chat to learn more.
135. That sounds like a um, good deal.
Right?
Also, Whitman-Walker is open for HIV and STI testing and counseling again. So this is Monday through Friday from 9 a.m. to 5 p.m. The main difference is that it is by appointment only. So just give us a call at 202-797-4439 to make an appointment today. And as always, all of our services are free.
So what about the phone lines? What if you can't get through on the phone lines to make your appointment?
Excellent question. You can also feel free to email us on the information linked below, and we can reach you via email as well.
Okay. So for all of the participants in the live today, if you also would like to tune into our bag series, which will be getting started up, and you can join on the Whitman-Walker live platform to get additional information. But on October the 28th, you can sign up for the sessions for the bag series, get registered, and you can tune into our breast cancer awareness segment to get more information. Again, that date will be on Wednesday, October the 28th. And alongside of joining for the awareness on breast cancer, you can just tune into our bag series, which stands for Badass Girls Group, and get some more information as it relates to a wide range of topics.
Thanks for sharing that.
You're welcome.
And a touch of Tule said to make sure to wash your hands and wear a mask. I second that as well.
Me too. So, yeah, we're going to have a series of the month of October where Wednesdays we wear pink. Everybody should be wearing pink on Wednesdays. Any shades of pink. I got my pink on today, Nancy.
Not you calling me out.
Yes.
I do not have well, does my lip color count? That's pink.
Yeah, we can go for that. We can
Okay,
go
but
for
now
that.
I know. Now I know. Next Wednesday I will be.
Next Wednesday, pink. Anybody that joins in, we're wearing pink on Wednesdays in honor of Breast Cancer Awareness Month. So, with that being said, I hope you guys have gained some knowledge, uh, passed the information that you received for the gift card incentive, all of that thing, all of those nice and wonderful things, because who doesn't want to get a little bit of money?
Right.
Right,
Holidays are
Nancy?
coming up.
Yes. So there are 2 holidays coming up, and know that money can add up. So thank you so much for coming. Thank you for tuning in, and we'll see you guys another time. And don't forget, on Wednesdays, we wear pink, and to also social distance and wash your hands. How many times? How long do we wash our hands for, Nancy?
20 seconds.
20 seconds. We like to remember singing a happy birthday song.
Mm-hmm.
Okay. Thank you for tuning in.
Have a good night, everybody.
Have a good one.